First prenatal visit. What to expect and questions to ask. Is your first prenatal appointment coming up? Feeling nervous? Excited? Maybe both? You're not alone. That first OB visit can feel overwhelming, but today, we're walking through everything you can expect and exactly what to ask your doctor, so you feel informed, empowered, and ready to take that next beautiful step into motherhood. Hi, moms! So you've taken the pregnancy test. It's positive, and your emotions are all over the place. First of all, congratulations! Whether this pregnancy was planned or a total surprise, it's the beginning of a beautiful, life-changing journey. And right now, you're probably preparing for something that feels equally exciting and terrifying, your first prenatal visit. If you're a first-time mom, you may be asking, what will they do? Will it hurt? What questions should I ask? What if something's wrong? Take a deep breath. You've got this. And I'm here to help you feel more at ease. When does the first prenatal visit happen? Most women schedule their first prenatal appointment between 6 to 10 weeks of pregnancy, typically around week 8. If you're not sure how far along you are, your OB or midwife will help you figure it out. If you have medical conditions like diabetes or hypertension, you might be seen sooner. But in most cases, this first visit is all about confirming your pregnancy and laying the groundwork for your care. What happens during your first prenatal appointment? Let's walk through it together. 1. Confirmation of pregnancy. Even if you've taken 10 home pregnancy tests and we've all been there grinning face with sweat, your OB will want to confirm it. This is usually done through a urine test, a blood test, or both. 2. Medical history review. You'll be asked lots of questions about your health. Your last period. Any previous pregnancies or miscarriages. Chronic conditions like asthma, thyroid problems, or diabetes. Medications or supplements you're taking. Your partner's medical history too. This helps your doctor assess any potential risks or special care you might need. 3. Vital signs and physical exam. They'll check blood pressure, weight, possibly a pelvic exam and pap smear, especially if you're overdue for one. Sometimes a breast exam. Don't worry, your doctor will walk you through every step. 4. Lab tests. Your blood might be drawn for several important tests. Blood type and Rh factor. Iron levels for anemia. Immunity to diseases like rubella and chickenpox. STIs like HIV, hepatitis B, and syphilis. Thyroid levels, glucose, and more. You may also be asked for a urine sample to check for infection, protein, or sugar. 5. First ultrasound, maybe? Depending on your clinic or OB, you might have an early ultrasound too. Confirm the pregnancy. Check for a heartbeat. Verify the due date. Make sure the pregnancy is in the uterus, not ectopic. Sometimes this ultrasound is transvaginal, a wand inserted gently into the vagina, especially if you're still early on. Don't worry, it's safe, and seeing that tiny heartbeat for the first time? It's magical. What to bring to your first prenatal visit? Here's your checklist, moms. A list of your medications, supplements, and vitamins. First day of your last period, this helps calculate your due date. Any existing health records if you've seen other doctors. Your partner or a support person, optional but comforting. A notebook or your phone to jot down questions and answers. Your insurance information and ID. What questions should you ask your OB? Don't be shy. It's your body, your baby, your care. Here are some great starter questions. Is my pregnancy considered low risk or high risk? What vitamins or supplements should I take? Are there any foods I should avoid? What should I do if I experience spotting or cramping? How much weight should I gain? What's the best sleeping position during pregnancy? What kind of exercise is safe? How often will I have checkups? Also ask about vaccines during pregnancy, prenatal screening options for baby's health, Birth plan preferences, even if it feels early, it's good to start. And here's a big one. What's the best way to reach you if I have concerns after hours? Tips to help you feel more at ease. 1. Write everything down ahead of time. You'll forget half your questions once you're sitting in that cold exam room. It's normal. 2. Don't feel embarrassed. No question is silly when it comes to your health or your baby. 3. Take a deep breath. Your OB is there to support you, not judge you. 4. You are allowed to change doctors if you ever feel unheard or uncomfortable. 5. Trust your intuition. This is the beginning of motherhood, and you know more than you think. You're not just a patient. You're a mom now. This first visit can feel overwhelming, especially if it's all new. But it's also a beautiful first step into motherhood. You're starting a partnership with someone who will help guide you through the wild, messy, amazing adventure that is pregnancy. Every test, every question, every visit from here on out, it's all about keeping you and your baby safe and healthy. So give yourself some grace. You're doing amazing. Thanks for spending time with me today, Mama. If this video helped ease some of your nerves about your first prenatal visit, give it a thumbs up and don't forget to subscribe for more real talk on pregnancy, baby prep, and motherhood. Drop a comment below. What were you most nervous about for your first checkup? Let's help each other out. You're not alone, and you're doing better than you think. See you in the next one.